Thank you. Because again, going back to what I said at the beginning of our conversation, I think there's a lot of shame, or at least a lack of clarity as to how one gets help for issues that relate to the genitals, right? Because hopefully your headache doesn't warrant going to a neurologist, but it might. Eye stuff tends to be ophthalmologists, optometrists, right? So I don't think we hear often enough about where to access the best quality care for these things. So thank you for that. In thinking about sexual dysfunction, I'd like to have that conversation more or less in parallel, if we can, around male sexual dysfunction and female sexual dysfunction. And I want to make sure that before we do that I'm creating the correct parallel construction, as they say. Erectile dysfunction in males is clearly a form of sexual dysfunction. What is the parallel to erectile dysfunction in females? Is it lack of vaginal lubrication and lack of relaxation of the vagina to have non-painful intercourse? I mean, is it even possible to have a parallel conversation about these two things?
So it's different. In some circumstances, there are homologs, right? So the penis is the homolog of the clitoris.
Right.
So the clitoris is essentially the same sort of spongy erectile tissue that you see in the penis. It gets erect with arousal, and it actually extends very deep into the pelvis. So it's not just a small little organ, it's actually quite long. And so in men, you can have erectile dysfunction because you can see it, but in women, you may have difficulty with orgasm. And it's not exactly a parallel, but difficulty orgasming in women is multifactorial, and we can get into that. But I think they're different, and I think also sexual dysfunction presents differently in both genders. So